Respiration coordination is one of the movements that we're really starting to look at more closely these days. Recognizing that it has a significant influence over patients with upper cross syndrome, neck pain, headaches, and also the ability to maintain core stability makes this an important test to take a look at in almost all of our patients. So as we take a look at the respiration coordination, we're looking to see the rise in the chest and compare it with the rise in the abdomen. So a lot of times when I'm teaching this to a patient, I'll ask them to put one hand on their chest and one hand on their abdomen so they can actually feel what's going on. What we should see is that the rise in the abdomen exceeds the rise in the chest. Now when I say that, it doesn't mean that it's going to go higher than. It means that it's going to be relatively moving more out of the abdomen than it would be in the chest. Obviously, if someone has more tissue on the chest or on the abdomen, that's going to influence how high it actually gets. But you'll find that as he breathes in deeply here, you should see the abdomen move more, the chest move less. If the chest moves more, we refer to that as paradoxical breathing. It puts a lot of extra stress on muscles of accessory respiration, like the sternocleidomastoid, platysma, and the scalenes. And so those are some common pain generators. They also contribute to the upper cross syndrome. As the patient breathes air into the abdominal cavity, that helps to create pressure from within to help stabilize the lumbar spine. So if you find patients who are doing lower extremity or lumbar exercises and they tend to hold their breath in a Valsalva position, a lot of times they're trying to create that because of dysfunctional respiration. So we'll use this as a way to educate them about reestablishing breathing patterns that are going to be more consistent with their lumbar and core stability.